World Health Organization has now sounded an alarm over the limited information on emerging health concerns in the United States, especially the recent outbreak of the avian influenza among dairy cattle in the US.
Well, the global health body has declared its intention to come up with a $50 billion in empowerment or endowment fund to enhance the quality of funding, as Elizabeth Atieno gives us the details.
The World Health Organization has revealed that it has not been receiving any technical and scientific information from the Centers of Disease Control in the United States since the 24th of January 2025.
And we have limited information about the spread of avian influenza among dairy cattle in the US or human cases. We ask the US to consider continuing its funding at least until solutions can be found.
CDC right now is not reporting influenza data through the WHO global platforms, FluNet, FluID, that they've been providing information for many, many years. And we have not had direct communication with CDC related to influenza. We are communicating with them, but we haven't heard anything back.
The sudden suspension of U.S. funding and the sudden disengagement of U.S. institutions like the CDC is also affecting the response to global efforts to eradicate some public health emergencies such as HIV, malaria, polio, and mpox in African countries, including Kenya, which has so far reported 41 cases of mpox.
There are limited waivers that have come forward to be able to allow access to life-saving treatment, including antiretroviral therapies, mother-to-child transmission.
Legally, the WHO Constitution and the UN Charter does not have a withdrawal clause in order to ensure universal health service delivery on the global sphere. Of the 194 WHO member states, the United States is the only country that reserved for itself the right to withdraw when it joined the organization in 1948, a reservation that was supported by all other WHO member states.
Only the U.S. made this reservation. No other member state then or since has made such a reservation.
The World Health Organization states that if a country such as Argentina intends to withdraw from the organization, the matter can only be decided by the World Health Assembly.
Historically, in the first decade of WHO's history, there were a few cases where member states, without a reservation, announced their withdrawal. However, these cases were not regarded by the World Health Assembly as withdrawals. The countries involved were regarded as having inactive status.
WHO now says plans are underway to come up with an endowment fund that is going to improve the quality of sustainable financing.
And the idea is for WHO to have a $50 billion endowment. And this could generate, as you know, endowments of 50 billion, for instance, can generate 3 to 5%, which is equivalent to 1.25 to 2.5 billion annually.
Elizabeth Atieno, TV 47.